Okay, this is the next day. Go ahead and tell us how you're feeling.
I'm feeling really well. Yesterday I went home and just napped for a little bit, and when I got up I could walk much better, more steady, and my low back pain was mostly gone. And I could do a little bit, like just leaning that little bit forward and back that normally kinks me up. I could do that, which was really good. And this morning I'm walking really well and sturdy, and my neck has calmed down. So, and I can actually like look up and down, which normally, makes me twitch a lot. So.
And no spasming.
No, if I take this out, it will spasm. But this is pretty good for me to be able to lift my head up that far.
Okay.
And I don't have any. I'm walking pretty evenly.
Okay.
So really good.
Good. Let's see. So your hands aren't shaking anymore.
Nope.
Let's see.
Nope. I can hold my head up by itself.
Okay, go ahead.
Keep in mind that these results were obtained within 24 hours of her initial appointment without the use of medications or psychological therapy to suppress her symptoms. We are trying to treat the prime cause of her symptoms, which will be revealed to you as we go through this DVD. Okay. Her opening has increased to 46 millimeters. Yesterday it was 41 millimeters. That's a 10% improvement just right there. We're going to do a final adjustment and then send this young lady back to Cleveland. Jump shot. This is the final splint configuration. Okay.
Wonderful.
6 or 8 weeks, sweetie.
Yep, we got 6 weeks planned.
Okay.
Already in the book.
Good.
Thanks, you guys.
Bye.
Remember her initial appointment when you saw the MRIs hanging on the view box? These are MRIs through the left and right temporomandibular joints in both the closed and the open positions. The big question is, what did they reveal? Because you recall I told you that most of these patients were both Tourette's and internally deranged TM joint patients. And although we have addressed the Tourette's symptoms, it is not sufficient, in my mind, to do just symptomatic treatment. You have to address the prime cause of all the symptoms. It is now time to address the TMJ symptomology. The MRIs reveal that the discs within each joint were anteriorly dislocated without reduction. That means they were displaced to the front and did not go back into place upon opening of the mouth. This is why it hurt her to open and why her interincisal opening was limited. Although you may think 46 millimeters was a normal opening, to me it is an impairment of function. The normal opening should be 50 to 54 millimeters, in spite of what you may have been told by other people. So therefore, we now address the internal derangement, and we do this by open joint plication surgery. It has been my experience over the past 45 years that if you address only the symptoms without the TMJ dislocation, the treatment will have no stability and the symptoms will return within 1 to 3 months. Therefore, to provide long-term stability in the treatment of these cases, we must get the left and right displaced TMJ discs into their normal anatomical position in such a way that they stay there. And we do this through left and right open joint TMJ plication surgery. Those of you who are healthcare providers should know that it takes a very courageous patient to proceed with this step of TM joint surgery, because they have experienced such an improvement in their symptoms that they are afraid that they will risk losing this improvement if they go on to this additional treatment. To me, this is an irrational fear. It will only improve them if the surgery is done correctly. That means that you must pick the proper surgeon, because all surgeons are not alike, even though they think they are. Secondly, there are two enemies the patient has. One is their immediate family, who fights against them tooth and nail by saying, oh, Dr. Stack is too far away, oh, he doesn't accept insurance, oh, he costs too much, etc., etc. And the second one is their local healthcare providers, who have usually failed in all previous treatment, but thinks that any treatment that anybody else does will not work. So they caution the patient to not deviate from what they suggest or to continue with their failed procedures, etc. And you will have these hurdles to overcome. This is the patient 3 days post-surgically. She had a left and right open joint plication procedure. I've reviewed with the patient what her presenting symptomology was, and she's going to tell you the improvement.
I feel great. I'm surprised at how great I feel I can move without tremoring, and my back and my neck are not hurting. I can do the opening of my mouth without tremoring. When Dr. Stack was just measuring me and taking my appliance in and out, my head wasn't shaking, my arms weren't quivering, and I'm not in pain. I've been in pain for a very long time, so I don't even know how to explain it. It's really wonderful. Do you want the specific?
You had trouble walking, right?
I had a lot of trouble walking.
Okay, why don't you get up and walk out there and then back, and we'll just...
I can get up and down without using a cane or a walker, and I can walk
Okay, see that?
with a regular stride. I don't feel like my thighs are pulling on my back anymore, and I feel like and my neck isn't sore just like all the time. Usually it's hard for me to just hold my head up.
Okay, do it one more time up to that. Bring it back.
What's the difference likely to be when she's off the medication?
Even better. Even better.
Be able to much better. Except my chair's
Okay.
yeah.
Okay, we are rebalancing the patient's surgical splint to compensate for any spasm, muscle spasm, swelling, etc. And then we'll dismiss the patient and see her in the near future. This is the patient returning 10 days post bilateral TMJ surgery. And she's going to explain to us what improvements she's experienced in function and symptoms during this past 10 days. She got her stitches out this morning at the oral surgeon's office, and that's why she's in here seeing me a little later on the same morning. Okay, tell them what you need to tell you.
Yeah, wow. Since surgery, I have not felt my back pain, which I've felt for years, like 10 years. I've had back surgery, gone through everything. I've always walked funny. I've had neck problems, torticollis, tremoring, twitching, and I haven't had any of that at all since surgery. So I don't, it's amazing. But I walk straight, I don't need my cane. I can stand up and sit down without hoisting myself. I can get in and out of the car. I can hold my head up without, and sit, without doing my twitching.